Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin. How's it, How's it, Em? So happy to be here. Really excited for our first episode of the Ovarian Club, and just really excited to get this started, to have these conversations about health that can hopefully empower others on their health journey. So with that, maybe Tab, we can start off with some introductions, and you can introduce yourself, maybe do a little speed dating intro style, and some of your I'm really good at that. Some of your aspirations behind this podcast.
Cool. First off, well, before I formally introduce myself, I just want to state how exciting it is to finally be launching this passion project of ours and bringing it to life, merging both my love for women's health as well as babbling away. We've been speaking about this for the longest of time, so it's just so incredible to finally be launching this podcast, the Ovarian Club, and spreading health awareness to all women around the world and really manifesting our dream and putting it all to life. So I'm Tarryn. I'm a 32-year-old medical doctor working in Cape Town, South Africa. And currently I'm working as a GP in private practice at a university. So most of the patients I see are young female students, 80% almost. And I also have been consulting quite a few patients in menopause, and often these patients are just so lost, confused. They don't know where to go. You receive so much health and misinformation out there. And I'm actually, quite frankly, appalled by the lack of awareness centered around women's health. And really, this prompted me to get this podcast going and empower patients to take control of their health and, just thrive, essentially. So before we get into it, I just wish to state two disclaimers. The first one, I'm not a specialist gynecologist. I'm a medical doctor who happens to have extensive experience working in the field of women's health, obstetrics and gynae specifically. So I did my community service training for 1 year at a really well-respected hospital based here in the Western Cape. So I'd like to believe I know a thing or two about women's health. The second disclaimer is that while I am a medical doctor, it must be declared that this podcast does not serve to offer any personal medical advice. So always seek the advice of your own healthcare professional with any questions you may have regarding a medical condition or treatment. Disclaimer's done, boring stuff out the way. Let's get into it.
Fantastic. So maybe I can also just introduce myself. I'm Emma Ichai. I'm also South African, but I have been out of South Africa living outside of South Africa since 2011. I've been back many times, but I'm currently living in France, married to a Frenchman, hence my location in the south of France, which I think sounds a lot more glamorous than it is. Also, probably a disclaimer about my accent. I have been out of South Africa for a while, so probably why I have such a strange, unplaceable accent that Tarryn always mocks me about. But I'm working in pharmaceuticals, so also just a little disclaimer that all the opinions mentioned on the podcast are mine and not reflective of any of the companies that I'm working for or maybe invested in. And just really excited about this passion project. So a little bit more about me. I really started becoming interested in health awareness quite early on. I have had quite some health struggles since around the age of 16. Luckily, nothing really serious, but I always seem to come across new findings, new things. And I think you could almost write an encyclopedia of all the different experiences I've had. And being outside of South Africa, being very far away from my home, from my culture, and trying to navigate the health space in Europe or elsewhere can be kind of daunting. I mean, it's daunting as it is, especially when you're trying to navigate health situations, but especially in a foreign culture, sometimes in another language. Trying to talk about like cardiovascular health in French is definitely not my specialty. Or women's health in French, or just speaking in French generally. general, but it can be quite daunting as it is. And I've just been so privileged to have you, Tat, not only as my best friend, but also as this medical resource that I can turn to and just to chat through everything I'm experiencing, and not to turn to Dr. Google, which makes you think you have a brain tumor whenever you have a headache or whenever you have any kind of symptom whatsoever. It's just a terrible idea. So we thought, hey, like, we're having these amazing conversations, so lucky to be having them. How can we open up these conversations to more people who are either expats like me, trying to navigate a foreign healthcare system, who are otherwise just really interested in women's health and wellness, or just really wanting to tune in a conversation between two best friends across two countries. So really very, very excited about the Ovarian Club. Brings us on also to our first topic of today, which is around Polycystic Ovary Syndrome. And I'm really glad I'm saying it right, because Tarryn and I discovered very recently that we've been calling it Polycystic Ovarian Syndrome. All of this, as I'm not a doctor, I can probably get away with it, but you follow. But yeah, so our first topic of today is Polycystic Ovary Syndrome and why we chose this topic, and a little also into what catapulted us to actually start this podcast. I was recently diagnosed with Polycystic Ovary Syndrome. I've had quite a journey when it comes to my menstrual cycles. Again, ever since I was 16, got quite ill. Still don't exactly know what the cause of it was, but had a lot of issues with my menstrual cycle. And maybe that's where it kind of started, that inflammation or whatever it may be that brought this about, and have seen many, many doctors over the years, tried many different things, and never really gotten to the bottom of it. And recently went off the pill, had a lot of different symptoms that weren't really ideal. And turned to Tarryn and had these conversations with her, and advised that I go to a doctor, which I did, and ran quite a lot of tests, and finally came to the diagnosis that I had PCOS. And so we thought, hey, let's dig into it. One of the things also I did is I turned to my other best friend, ChatGPT, and Dr. Google, and that is definitely
no, Emma,
not advised. Even my doctor in France was like, do not do that. Do not Google this. Do not Google this. It is a terrible idea. It sounds really, really scary. But so today we're going to tackle PCOS, understand what it is, what it isn't, very importantly too, some of the symptoms around it, what are the treatments for it, how much of it is to do with lifestyle, etc. But before we do, in the simplest of terms, can you describe or can you explain what is PCOS?
Sure, it will be an honor. Yeah, PCOS actually is quite a complicated condition to explain. It's really complicated because there are so many mechanisms underpinning this very common hormonal disorder. But in a nutshell, what is it? It is essentially that. It's a hormonal disorder that affects young women, typically in their reproductive years, and basically just causes havoc with regard to menstruation, metabolism, and a whole range of other signs and symptoms. But before we really go into it, I think it's pivotal to have a basic understanding on an anatomical and physiological level what goes on in the female reproductive tract. So women, young girls, those with double X chromosomes, they're typically born with 1 to 2 million little immature eggs. And by the time a girl reaches puberty, she has 400,000, roughly. I didn't count this myself, but this is what the textbook says. With every single menstrual cycle, so when a girl is gearing up to ovulate between days 1 to 14 of the menstrual cycle, 11 to 20 of these 400,000 eggs are recruited, these small follicles containing these immature eggs. And only one of these eggs, sometimes two in the case of dizygotic twins, but only one of these eggs is then subsequently recruited and the girl ovulates. And, then, if there's the lucky sperm chilling around, pregnancy. But in the case of PCOS, girls struggle to ovulate typically. And this is due to these hormonal disruptions and this accumulation of these preantral follicles with the immature eggs, leading to a whole hormonal signaling cascade and difficulty ovulating and what have you. We will also touch on the various metabolic derangements that occur in the body as a result of these hormonal imbalances and presence of these immature eggs, the follicles as we call them. So I hope I kind of made that as simple as possible. It is quite complicated to understand, but that's a basic overview as to what PCOS is.
And do we know what causes PCOS? How much does lifestyle have to do with that? How much does maybe previous inflammations? What is the underlying cause of PCOS? Do we know?
No, that's the sad and short answer. No, we don't know the exact cause, but it's believed to be a combination of both genetic and environmental factors. I would say there generally tends to be a very strong genetic predisposition. Hence, while lifestyle factors, while they may contribute to PCOS, they are definitely not the underlying cause. I would say it's more genetically driven, but lifestyle factors do have a role to play. They're just, however, not the cause of PCOS.
And can I just double click on the genetic aspects? What do you mean? Is that if you have a history of PCOS within your family? Is it if you have a history of other illnesses like diabetes or whatever it may be? What are we looking for when you say that there's genetics involved over here?
Good question. Gosh, Em, you're putting me on the spot here. Very good question. No, these are high level questions, and they are most welcome. There's a lot of genes at the end of the day that have a role to play in the development of PCOS. Hundreds, which is what makes it so difficult to identify, on a genetic level, because there's no one gene, right, that can explain the manifestation of PCOS. However, what you said before with regard to a family history of PCOS, that is a very strong risk factor for a patient subsequently developing PCOS. And yes, type 2 diabetes, metabolic syndrome, obesity, these are huge driving factors as well for the later development of PCOS. But that's not to say it's the cause, right? We have lots of patients running around with type 2 diabetes, obese, they don't have PCOS. So no, it's not a direct cause, but it can push one over the edge and, bring out the PCOS that is underlying it, if that makes sense.
And before we get into that and talk around the symptoms of PCOS and what that looks like and the manifestations of PCOS, taking just, again, a little step back, one of the things when I've spoken to friends and I've mentioned to them that I have PCOS and they ask me, what is this? One of the things they ask me about is, does this mean you have cysts on your ovaries? And doing some little research myself and then speaking to you, this is clearly a misnomer. And from my understanding of it, you can get cysts on your ovaries, but it's not that you necessarily have cysts on your ovaries. So can you speak a little bit more to that? Try to demystify that a little bit.
Yeah, 100%. So yes, despite its name, not everyone with PCOS has ovarian cysts, okay? And the cysts that I alluded to earlier are those small follicular cysts, which are actually deemed physiological cysts. So they're not pathological cysts in the sense of the word. So generally as doctors, if we mention that a patient had an ovarian cyst, we fear for other complications, cyst rupture, cyst torsion, a whole range of other issues. And this is not necessarily the case with PCOS. Okay, so with PCOS, you just have these small little immature follicles. Yes, they appear as little sacs that look like cysts. We allude to cystic features on ultrasound, which is one of the diagnostic criteria of PCOS, but not the only one. So yes, it may or may not be present in patients with PCOS. So in other words, not everyone with PCOS may exhibit these signs on ultrasound and still have PCOS. And the converse is also true, what you said. Yes, patients with PCOS may also have ovarian cysts, but it's not the same thing.
So I think you touched on it also in talking about the ultrasounds and how to find out whether or not you have PCOS. So let's go back and talk a little bit through the manifestations of PCOS. What are the symptoms? Yeah. What could make you suggest that you would have PCOS? And then talking a little bit around maybe the tests that doctors would run, or what is a doctor looking at in terms of the symptom checklist that you have that could suggest that you do have PCOS. Okay. And by the way, I'm loving this foliage behind you. I'm feel like you're in the jungle or something. I just have to put that.
I love it for me too.
You've got this little leaf that's going over your shoulder, and it's really it's wonderful. So
Not everyone can see our video for those listening to the audio on Spotify, but yes, it does look like I am sitting in a jungle, and I have done this for y'all who's tuning in to the video.
It's a little leaf on your shoulder, but yeah, sure. Sorry. Slight
it's nice aesthetic, right? Slight digression. So, okay, before we touch on the signs and symptoms, because PCOS is largely a clinical diagnosis, yes, we can run blood tests, but you can make the diagnosis of PCOS purely based on symptomatology. So before we go into the symptoms, let's just understand two key principles. The first one is insulin resistance, and the second one is hyperandrogenism. Big word, don't worry, I'm going to break it down for you very shortly. So let me take a step back. What is insulin? Insulin's a hormone. It's secreted by the pancreas. And what it does is it signals to the cells to soak up the glucose, the sugar that's lying in the blood. So what happens in the case of hyperinsulinemia, when the body has too much insulin in the blood, the cells are almost bombarded by so much insulin that they become desensitized to this insulin. It's like, oh, okay, it almost as if it has no impact on them anymore, okay? So the insulin doesn't do its job. And as a result, the glucose does not go into the cells. It remains in the blood. We call this like hyperglycemia. And over time, the blood sugar levels essentially rise up. So that is the first principle that I want to, just touch on. The second one is hyperandrogenism. So what is an androgen? An androgen is a male hormone, typically testosterone. Yeah. Girls have testosterone too. In fact, girls actually have more testosterone than they have estrogen, which is quite a wild fact. So testosterone is produced, in the adrenals, but it's also produced by these little eggs, the eggs that's sitting in the ovaries. And in the case of PCOS, because there's all these hormonal dysregulations in the body is producing too much testosterone. And this results in some of the many features we are going to touch on now. So hyperandrogenism just means like high testosterone, higher than normal, and it is a result of PCOS in this case. So how does it manifest? So symptom number one, if a patient comes to me and she's like, Doc, I'm not on any hormonal contraception, haven't been for years or months, whatever, and I am not getting a period, or I'm skipping my period, or it's something abnormal with my cycle, this could suggest that the patient has underlying PCOS. Could be other reasons, could be stress, could be a whole range of other hormonal diseases. We're not going to touch on that now, but one of them is largely due to PCOS.
And sorry, just to jump in just over there, when you say abnormal periods, I mean, beyond just maybe skipping periods, beyond periods being late or not having any period whatsoever, is that also the duration of the period? Like how many days you have the period?
Yes.
I know that's different for every single person, but just to kind of dive into
Great.
that a little bit.
Glad you asked. So the typical menstrual cycle, they say, is 28 days. But this is not normal for everyone. For example, my cycle is it ranges between 21 to 35 days. It's like a huge fluctuation in the days. Okay, mine's not that fast, but that is, an acceptable variable period, right? So not everyone menstruates on day one of their cycle of 28 days, okay? But I always say to my patients, keep a diary, right? And if you find that you are deviating from the 21-day to 35-day norm, or you're skipping a month entirely, and this is happening for months, this is usually suggestive of an underlying problem. But as I said, this is in the absence of hormones or the absence of stress, smoking. Like there's so many other lifestyle factors to take into consideration. But yes, if it's different from your norm, then there's something that could be underlying. So typically irregular menstrual periods, this is due to anovulation, so the lack of the ability to ovulate, which we touched on earlier when we mentioned the definition. Other symptoms that doctors look at closely on examination are the features of hyperandrogenism that I explained earlier. So that is hirsutism. There's also a fancy word. It just means excess facial body hair, or hair where it shouldn't be. So typically on the face, and very acne, oily skin. This is something that we can also see.
Yes, it's definitely, it was my experience. Felt like I had teenage skin, so it's definitely can share with that one. Just to also ask with regards to like the abnormal hair on the face, it was luckily not something that I experienced, but what are we looking at? I think I also Googled hirsutism, and it kind of has that werewolf pictures that do come up on Google. So I think, can you just touch on that? What is abnormal hair on the face? Is it just a couple of black hairs on your face? Is it just anything that is unusual for you, or?
Yeah, unusual for you. But I think if you have the presence of hair and you're a female, then I would say consult a doctor to have that evaluated. Then we have weight gain. This is typical when it's largely metabolically driven, the PCOS, okay? When there's more features of the hyperinsulinemia, so the insulin resistance that I touched on earlier, patients can really struggle to lose weight. They're putting on weight. And then lastly, infertility. Now, again, I just want to caveat and say not everyone who has PCOS will experience infertility. But generally, this is a warning sign if a patient is trying to conceive, they're having regular intercourse with their partner in the absence of contraception for more than a year, and they're failing to conceive, then they consult a doctor. Generally, the doctor is going to look for PCOS as an underlying driver, among with other factors, of course, and male factors. I mean, it's a whole other podcast topic. We will touch on that. But yes, those are the main signs and symptoms that doctors will look out for.
And I think,
of course, the ultrasound, which is not a... Yeah, it's not a, you don't have to see the follicular cyst on ultrasound because it also depends where the female is in her cycle. But if they do see it on the ultrasound, then it is very highly suggestive.
So 2 things I kind of want to dive into a little bit before we also talk a little bit more into maybe the side effects or what are the major concerns about PCOS. And you did already touch on that with regards to infertility. Again, not everyone will face that. But first of all, the first topic is around this weight gain. Personally, I didn't experience that. I actually experienced weight loss. But that's where I came across this term of lean PCOS. So I'd love to dive into that. And then the second topic I'd like to talk about also around the symptoms is sleep apnea, because that's something that I came across as a link. And I do have mild sleep apnea. So I was in a sleep clinic over Halloween. It was quite an experience. I was all wired up with all of the stuff. Story for another time.
You've been through the most.
Yeah, definitely been through the wrongs. But so that was something that
what did you do wrong in your past life?
I don't know, karma. But it's there's an entire. I mean, I think with all my health stories, we can form every single podcast episode for a very long time. But and swear to God, I'm not just a hypochondriac. Although my husband may disagree with that. But yeah, so just before we go into sleep apnea.
Lean PCOS.
PCOS.
Yeah.
Can you talk about that?
Yeah.
Can you also talk about like how insulin plays a role when it comes to lean PCOS? Because generally, like I think the general conception around insulin resistance is to do with weight gain. But what I have read is that people with lean PCOS can also have an insulin issue. But let's first talk about what is lean PCOS.
Let's delve into it. So I do admit, first and foremost, that this is a very confusing picture, right? Because typically we would expect the woman to be slightly overweight. And this is because of the high androgen levels that I attributed to earlier. So in the case of lean PCOS, women may not gain weight despite higher than normal androgen levels, and hence the confusion. But this does not mean that they are not predisposed to metabolic issues, which is why any patient, even with lean PCOS, must consult, well, they should be consulting a doctor who's still screening for metabolic issues and hyperinsulinemia. But the consensus is that it's not the driving factor, okay, in the case of lean PCOS. What is the driving factor is the chronic low-grade inflammation, which causes the hormonal dysregulations in the body, and then the lack of ability to ovulate and whatnot. Those are the more like driving features, less the insulin resistance, but the fat may also deposit viscerally, and you may not see it. One could still have metabolic derangements in the body. So just because it doesn't manifest with central fat deposition on the body does not mean that one does not have metabolic issues, but it's not the driving factor that's pushing the pathophysiology behind the disease, if that makes sense. But then a question that you mentioned earlier, which I want to touch on, how does high insulin kind of precipitate PCOS? What it does is the high insulin in the body actually increases androgen production in the body. Okay, so that results in oxidative stress, which is a very fancy term for just worsening inflammation in the body. And that worsening inflammation, as like a vicious cycle, can worsen the insulin resistance if the patient has that underlying. So it's a very vicious feedback loop. And it is something to look out for.
Okay. And understanding you correctly, insulin resistance, still something to look out for in lean PCOS, even if there's not manifestations of weight gain or glucose spikes, even if you're doing those blood tests, etc. But it is important to still address that. And I think it would be, yes,
Yeah.
it would be also good to chat through that a little bit when we do talk around, what are the medical interventions that you can do, and we can address that in terms of lean PCOS. And yes, sorry, go ahead.
You mentioned sleep apnea, and yes, I will touch on that very briefly, but I'll also touch on that in relation to the other complications of PCOS. So I think without further ado, let's just delve into that very quickly. So sleep apnea, very interesting one. Typically, again, patients that are obese, excess neck fat, they are more predisposed to developing sleep apnea. So basically like low quality sleep. Patients are mouth breathers, not nasal breathers. It has like a whole consequential knock-on effect for individuals, and it can be really, really debilitating. But in the case of PCOS or lean PCOS, if apnea is something that you experience, the mechanism underlying this is thought to be the excess androgen production yet again. And who would have thought that increased androgens affects the upper airways and it affects the neural controls of breathing? So basically kind of causes airway blockages. And I just want to caveat that and say that it's one of the ways, right? I mean, there could be other mechanisms in your case. In the case of PCOS, that's usually one of the explanations as to why a patient might develop sleep apneas if they're not obese. If they are obese, then we know that there could be other reasons like that adiposity around the neck that's obstructing, of course. But yes, hormonal imbalances is thought to actually also play a role with regard to airway flow and subsequent obstruction when it's dysregulated.
And there's so much that's linked, right? Because it's such a vicious cycle around sleep, because sleep is so important when it comes to your lifestyle changes, what you need to do to also get your PCOS under control, which I'd love to dive into a little bit more in terms of those lifestyle changes. But before we do, other complications.
Yes.
Let's kind of close that off, wrap on that before we move over into kind of the lifestyle.
I tend to derail. So totally you must bring
guilty.
Me back. You must bring me back when
guilty
I derail.
Of that one too. 5 thoughts.
So other complications. I mean, the main one is metabolic, disturbances. So type 2 diabetes, obesity. These are ones that one really needs to screen for, look out for. But also cardiovascular illness, sleep apnea, as we've already mentioned, and anxiety and depression. So who would have thought the mental health complications that ensue as a result of PCOS? And the main underlying mechanisms for this, well, firstly is like poor body image, but also the excess androgens in the body and the altered cortisol responses in patients with PCOS. This is thought to affect brain function, mood regulation, stress resilience. Then there's also a slightly lower progesterone levels in the case of estrogen excess. So like these hormonal, dysregulations, one could say there, that could also contribute to mood instability. And then lastly, there's the insulin resistance and chronic low-grade inflammation that in and of itself is linked to depression and anxiety through disruptions in brain chemistry and neuronal pathways. So many mechanisms to tap into there, but really fascinating to think that PCOS can have such devastating effects on one's mental health.
And for me, that's kind of, it goes back to what I was saying around the vicious cycle and the kind of chicken and egg, right? Because from a lifestyle perspective, in terms of lifestyle solutions to try and manage your symptoms of PCOS, some of the things I've come across is around stress and stress levels. My doctor here, he's been saying to me, most important thing is you don't stress. Another reason why it's a terrible idea is to turn to Dr. Google, because that's totally going to make you stress out more around PCOS and your symptoms. But one of the main things that I have read about is how important it is to get your stress under control. But then by the sounds of it, your PCOS is probably elevating your stress, not only just because you have PCOS and you're thinking about it, or you may be undergoing fertility issues or other issues, weight gain, whatever it may be, your skin, appearances, fatigue, whatever it may be, sleep apnea. Sleep is so important, but all of these aspects seem to be exacerbating factors of PCOS, and yet PCOS seems to also cause these aspects. So from a lifestyle perspective, how do you just get off this little like hamster wheel of these symptoms?
Yeah, you explained that so eloquently. I was going to explain it in medical terms, like chronic inflammation exacerbates hormonal imbalances and metabolic issues, which then in turn can lead to ovarian dysfunction and worsen symptoms of PCOS and potential long-term health risks as well with regard to metabolic syndrome. And then obviously infertility on the other end of the spectrum. So yes, there is this vicious loop, and in lifestyle interventions are absolutely key to, get in there and stop this vicious cycle of chronic low-grade inflammation that is exacerbating these symptoms. So, okay, I'm going to just say the 5 points now so that I've said them. And if I digress, you can bring me back. But we're going to touch on diet. We're going to touch on exercise. We're going to touch on smoking, sleep, and I think that's all. Yeah.
Mental health, there's a few meditation,
more. Mental health, stress. Cool. So there we are. We've done them all. Okay, so let's get into it. So diet. Okay. So what is driving PCOS? Inflammation. So what does one need to do? Adopt an anti-inflammatory diet. Now, I know that sounds like really generic, but like let's just keep the principles really basic here. So what might be inflammatory for me may not be inflammatory for you, okay? But I think on the whole, the kind of diet that we are all exposed to in this modern day world is highly inflammatory and processed. So I think for everyone would benefit from a diet that is low in processed foods, takeouts, fast foods, foods that are packaged, high sugar content, like all of that. It's kind of basic, right? So that's the one thing that one needs to avoid. Then I also want to just caveat that and say that if one is known with an intolerance, say a gluten intolerance, like gluten might be inflammatory for you, it's not inflammatory for me. So yes, I mean, if you're in touch with your body's cues, you know what foods work for you, you know what foods don't. Like keep a food diary, know what are your triggers, and don't push your body into an inflammatory state. So that's like diet 101.
Which is, again, I think much easier said than done. Like I know, for example, I have a wheat intolerance. It's not the best thing for me. Dairy definitely doesn't agree with me. I get the breakouts and everything like that. Not a super fun dietary requirement to have when you're living in France. And like everything centers around baguettes and pasta and cheese and everything like that. So just
don't rub it in.
I miss those South African smoothies. But it's definitely easier said than
it is easier said than done.
I think it is a really important thing to be in tune with your body and to also listen to that and say like, hey, I know this is probably not great for me. I imagine with diet, there's also other elements around gut health. So your probiotics would be really important, right? Or just in general, talking through gut health, alcohol, all of those things.
Yes. I want to mention supplements under medication. It's going to come now, but keep that in mind. Just remind me to mention it if we don't get to it. But in terms of diet, okay, so I'm not a dietitian. I'm not a nutritionist. So yeah, just disclaimer. But generally speaking, unprocessed foods that are rich in antioxidants, right? Because antioxidants are anti-inflammatory foods. So blueberries, whole foods, fiber intake. Fiber is so important for the guts. It has a huge role to play in reducing inflammation in the body and improving PCOS symptoms. So legumes, nuts, whole grains. Generally, I like to advocate for plant-based. I'm not saying everyone must go vegetarian, not at all. Eat a diet that's right for you, but foods that are definitely rich in color and plant orientated. So definitely eat more veg than you're eating processed meat. Or processed meat, don't eat anything processed. But if you're going to eat meat, eat chicken. And most certainly, like I would say, have oily fish rich in omega-3s, very important. But keep it plant-based. Make sure that most of what you're eating comes from plants.
Though I think to caveat, because I think with a lot of the vegan, because I'm pescatarian, so I don't eat, and I don't eat a huge amount of fish, but I try to incorporate it as much in my diet as possible. But a lot of the vegan products are very processed, so I think maybe just to kind of caveat there, it's more like your veggies, your other proteins.
But then coming back to what I was saying earlier is if you know that a certain plant doesn't agree with you, is going to like cause bloating and inflammation, well, then don't have the plant. Do you know what I mean? So it really is getting to know your body, getting to know your body's cues, what works for you, what doesn't. But as a general premise, avoid sugars, avoid refined foods. I mean, guys, it's kind of obvious, right? So those are the basics. Emma's having a little coughing attack, so I'm just going to
sorry, I just totally breathe something in. I don't know. I think it was like dust or something like that. That just
Okay, are you good? Okay, well, let me continue with exercise while you gather yourself. So with exercise, any exercise is good for you. That's like my overall disclaimer, like move your body 30 minutes a day, every day. I don't care what you do, move your body, right? But yes, some exercise is better or more recommended than others. So in the case of PCOS, the research does point to resistance training as it enhances insulin sensitivity by increasing muscle mass, which helps muscles utilize glucose more effectively, resulting in lowering insulin levels and improved metabolic health and function. So yes, I would advocate for that more than anything. But yes, you've got your steady state cardio, your running, cycling, all of that's good. I would say if you could incorporate that too into your weekly routine, there's nothing wrong with that. As long as you're consistent and you're just moving your body every day, then I'm happy. There's also HIIT training, which I would say is preferable over cardio, like your steady state cardio, those like bursts of energy. It has also been shown to improve insulin resistance and reduce excess testosterone levels in the body. So also very good. And then, of course, yoga, Pilates, which has immense benefits on stress reduction, stretching, promoting hormonal balance, and all of that. So I would say just find a routine that works for you. Move every day. I don't care what you do. Even a modest weight loss of 5 to 10% can have dramatic health benefits on a patient's life. So that's my take on exercise, or the literature's take on exercise.
How does that differ when we're looking at lean PCOS? Because some of the things that I've also read about is doing more low impact, especially around the estrogen levels or the stress levels that your body may go under. And when you are doing really high intensity sports, or if you are pushing your body too much, or if you
can cause cortisol spike.
If you're exercising too much, right? So if you're doing really intense training every single day or marathon, whatever it may be, and it's really intense for your body, where is that balance? How does that differ also when it comes to lean PCOS? What are the watch outs around exercise too? It's really important, but where do you strike that balance?
It's difficult, and I'm not an exercise physician. I don't profess to have all the answers here, but I think what you were touching on holds a lot of truth. So I think in the case of lean PCOS, where stress and chronic underlying low-grade inflammation are the leading drivers for the hormonal imbalances that we see, I would say focus on an exercise routine that similarly helps to lower stress, to help mitigate this the subsequent pathology that one sees in the case of PCOS. But for some people, running is actually quite soothing, believe it or not. Like going for a run, like really boosts dopamine. Like it's not that stressful on the body, especially if it's like a slow jog. Yes, it's just like finding a routine that works for you. That's all I have to say. But if you find that
running, and I've never found the runner's high, so I can't exactly like attach to finding that.
So don't do that.
Pure
don't do that
for me. But anyways,
yeah.
Definitely.
But I would say, but I would say stress reduction would be one of the main focuses in the case of lean PCOS, and not overexerting the body, causing excess stress and, disrupting hormonal balances even further. Then you're actually doing yourself a disservice. So, very tricky to manage, I must say.
So we have number 1, diet.
Yes.
Number 2, exercise.
Yes.
Number 3.
Now we've mentioned stress. We said stress already. We basically touched on that. If you're sleeping properly, which is one of the 4th pillars, but if you're sleeping properly, then you'd find that it also helps with stress reduction. But yes, it has a significant impact on lowering inflammation in the body.
So let's just tap onto sleep if we can, and then to circle back to stress. But with regards to sleep, I mean, if you're not sleeping properly because of your PCOS, because you have sleep apnea or whatever it may be, you do have a sleep disorder that's connected to PCOS, and we go back to that kind of vicious cycle, what can you do to sleep better? I mean, I think that's a topic of its own. That's an entire topic, but just like a few key pointers. Sleep is really important for your stress levels. It's really important for your body's functioning overall.
Yes.
1 or 2
helps mitigate inflammation.
Pointers or thinkers around thinkers. I just think I made up a word over there. But 1 or 2 pointers around good sleep hygiene when you could potentially have a disorder linked to PCOS.
Right. So 5 tips for optimizing sleep hygiene. Okay, let's go through them. Limiting caffeine intake throughout the day. Geez, a lot of my patients, they don't believe they're taking in caffeine, and then they like arrive at in my consult with Red Bull in hand. And they're like, no, but I don't have coffee. I'm like, guys, get with the program. So yes, caffeine is hidden. It is in the form of energy drinks as well. So please, for goodness sake, stop taking in that junk. It makes me sad. But yes, limiting caffeine intake. I would say like 3 cups a day is fine. I mean, obviously it depends on how it's made. Like not all caffeine is equivalent. So like an espresso versus a French press versus a processed coffee. Like caffeine contents differ depending on how one prepares it, is what I'm trying to say. But you find your norm. Some people are highly sensitive to caffeine. So what I do is I limit my caffeine to, I think, 3 max, but maybe just 2 cups a day, like 2 espressos. And I stop my last caffeine
a certain
at
time,
2 p.m.
right? Yeah.
Yes, correct. I stopped taking caffeine around 2 p.m. I mean, obviously, like when I was a medical student back in the day, I mean, I'd have to consume caffeine, in the nights. I mean, when I was working shifts on call, you'd have to have caffeine on call. But I mean, obviously, I do not advocate for this. It's not healthy. One should be sleeping. One should not be running around in the all hours of the night, working night shifts. But again, that's a separate issue entirely. Peace out to all my healthcare allies, saving lives, but also having such devastating effects on their health. It's really sad. I just wish everyone could sleep. But yes, limiting screen time is another one. So just put your phone away from the bed. I'm really guilty of this. In fact, I don't do this. Disclaimer. I should take my own advice. But so, putting the phone away from the bed, I know there's some impracticalities surrounding that. Like, how do I wake up if I set an alarm? You could still put your alarm on and like keep the phone away, like not next to the bed directly. But I definitely put my phone on airplane mode. That I do. And then there's some literature to suggest that one should eat a big meal hours before bedtime. But I know in Europe, like I lived in Italy for a year, and Europeans, or Italians at least, they ate very late. I'd like to believe they were all sleeping well. I don't know. But yes, the literature does say that if you do have an earlier meal, and it gives you time to digest that, and then you can go to bed and have a better night's sleep.
So drink way more coffee.
And then
that's
probably
compensates for that. But yeah. Probably there.
Then there's also supplements that can aid in sleep. We'll talk about that in another episode if that's okay for the sake of time. And then the last one is smoking. Okay, guys, lifestyle factors. Smoking, this is a huge one. It can worsen PCOS, and it does that by reducing ovarian blood flow, and this may impair ovarian function. So those wanting to conceive, who might be experiencing problems with fertility, like one of the first advice that doctors give patients is to stop smoking. I mean, the literature isn't out there yet with regard to vaping. It's been too soon, but I'm sure literature will come out soon. It's just a matter of time. But yes, it pushes the body into inflammation. It affects hormones. It exacerbates insulin resistance if one is predisposed. It can boost testosterone levels. And in the case of PCOS, we know that this is a problem. So smoking is bad. So
including secondhand smoke, like if you're around smokers, similar.
I would say including. I haven't read any specific paper that I can reference, pertaining to secondhand PCOS and smoking. Sorry, secondhand smoking and PCOS. I think this podcast is going on a bit long, but yes, I would imagine it can be good.
So, tell me a bit about the medical interventions.
Okay.
What is available? To kind of wrap this up, close it off, what is out there in terms of medical interventions? Obviously depends on what you're looking at with your PCOS. If you're looking to just get your symptoms under control, if you're looking to get a cycle back, if you're looking to get your weight under control, or if you're looking to fall pregnant. Imagine there's a whole host of different interventions, but quickly chat me through them.
No, honestly, you should be a doctor. Like, you've just summed it up. Like, that is the first thing a doctor would say. Like, well, what's your end goal? Are you wanting to just manage your symptoms, your insulin resistance, or are you wanting to achieve fertility? Because that would really dictate treatment modalities. So let's assume that you are not at the stage in life where you want to fall pregnant, okay? And you just have PCOS that's bothering you because of symptoms. So yes, the first advice we always give is lifestyle advice. So we've already discussed that. That's already been covered. So now we're going to go to medical management. And generally speaking, doctors do encourage patients to go on the oral contraceptive pill. The reason being is that the pill regulates menstrual cycles. It reduces testosterone production, which is a driving feature in PCOS. And it can improve skin health as well, if that is a concern. So why we want to regulate the menstrual cycles is quite important, because patients with PCOS are at risk of developing endometrial hyperplasia, okay? And this can predispose to endometrial cancer. And this is due to the estrogen-progesterone imbalances that is in the body as a result of PCOS, which can cause excess tissue buildup in the uterus. So it's important to get the patient to regulate their estrogen-progesterone imbalances, okay? So that is why it's patients with PCOS should consult a doctor and should consider going on the oral contraceptive pill, at least for some time in their life. So that's the first medical modality. But then we also have to look at the metabolic syndrome. So patients who are overweight, you want to look to help improve their insulin resistance.
But also in terms of lean PCOS, if, for example, you're on overweight, but you may still have this insulin resistance, would you still be looking at taking insulin medication?
Yeah, not insulin. I would be advocating for a drug called metformin. It's just an example of a drug that helps improve metabolic disturbances and improves insulin resistance. It also has a benefit with controlling inflammation in the body. Metformin is like a wonder drug. It has many positive effects. So yes, a patient with PCOS may too benefit from metformin, but a patient who's overweight will most certainly benefit from metformin. So there's still a lot of research going into the supplements. I'm not advocating necessarily for supplements. Definitely consult a doctor and first optimize with lifestyle interventions and medications. Supplements are just a way to assist the patient with his or her various symptomatology.
So thank you so much. I think there's so much I could spend hours and we have spent hours talking about this.
If we went over time.
No, not at all. I think it's hugely helpful us to hear about lifestyle changes, just understanding a little bit more about PCOS, what it is, what it isn't, where it comes from, where it doesn't come from maybe, and how to manage your PCOS. And definitely, if you are struggling with PCOS, you are not alone. There are a lot of resources out there to support you and to help you, but definitely consult your doctor or a medical professional for further advice and guidance. But thank you so much for listening in today to the Ovarian Club. We're so happy to have you. Would love you to join us as a member of the Ovarian Club. So please do hit subscribe or follow us on Instagram at the Ovarian Club. We are definitely going to tackle a lot more really interesting topics, from mom brain to skin health, gut health, talking about genes. There's so much to unpack. If there are any topics that you're dying to hear about that you really want us to tackle as part of the Ovarian Club, please just shoot us a message on Instagram. We can't wait to hear from you, and we're so excited to go on this journey with you.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. We'll see you soon, follicle friends.
Thank you.